Hello, San Juan County. I am Deanne Gallegos. I am the Public Information Officer for the Office of Emergency Management. Today, we are going to answer some frequently asked questions from the Incident Management team. And first, I'm going to have Mr. Jim Donovan, who is our Emergency Manager, and then Mr. Kimmett Holland, who is a Director of EMS. So let's get right into it, gentlemen. Mr. Donovan, can you give us a little information on what's going on with testing, or where are we at with testing?
Excellent. Yep. Good morning, Deanne, and thanks for having me on this morning. And testing is currently happening regionally. That has been a bit of a challenge, but it is now available at Cedar Diagnostics in Ash, in Durango, Ash Hospital. Currently it is $75. You just need to call Cedar Diagnostics and schedule an appointment. And it's good to go ahead and talk to your primary care physician before getting the test. They will do basically a pre-screening of that, but it is now available. So that's a great one to take advantage of. That's been a bit of a bottleneck. And then testing, we are working closely with the state to get testing available in San Juan County. I do want to just give people an idea that with the public health order, we have been very successful at basically keeping COVID-19 out of San Juan County. So currently, there are no known cases in San Juan County. We are sitting at 0. We have not even really gotten any very, very few calls of people even reporting symptoms. So that's been a very huge success. We have had one person who was tested in March, and they came back negative, and they had several factors that met the criteria to get the testing done.
Wonderful. So that is good news that there is testing now available for folks in the area.
Yes.
Great. Can you talk a little bit about the second homeowner and visitor policy that is currently in our public health order?
Yep, Deanne, I can definitely address that. And just so everybody knows, all of this information, it's available on the San Juan County website. And if you go to the OEM Facebook page, and I think also the chamber is putting info out there. So make sure that you read through these, because we are providing the more of the explanation of it, but it's just straight from the text. So if you are a second homeowner or a seasonal business owner, and you do return to San Juan County during the public health order, this goes till April 30th. We are asking that you do a voluntary 14-day quarantine. And we do have a quarantine tracking system set up. So if you do come to town, you can register with that. What that enables you to do is then request services. We will help you succeed in your quarantine. That's how important we consider it. So that means if you need food delivered to your house, if you need medicine delivered to your house and you can't, you're having trouble making that happen, we've got a group of volunteers in Silverton, San Juan County that can help you succeed with that. So we really want to emphasize the importance of the quarantine. We know several people in town who have quarantined or are currently quarantining, and they're taking it very, very seriously, and they're being very successful with it. So we just want to emphasize that importance.
Great. Yeah, and I am getting a lot of those questions, and folks are trying to make plans for May, and it's just like as you stated, our public health order goes till April 30th, so it's a little difficult to predict into May. But as soon as the state or local changes are made, rest assured we will get that information out. But our current public health order goes till April 30th, correct?
Correct.
Okay, great. So Jim, can you tell me what San Juan County's plan is, what leadership is doing in this valley about a reopening strategy?
Yep. Thanks for asking that question, Deanne. That's been a big topic in the past week. And so we've been taking a whole community approach. So we're getting input from businesses and essential government functions, and making sure that our reopening strategy is really good based on science, but also including economic interests as well. So we're treating the next phase more as, I'd say, more of a surgical approach. We're going to be providing more specific information on how businesses can operate in a safe manner. We've done such a great job with this phase of the public health orders for the past several weeks now, and we'll go up to April 30th. And we are one of only 8 counties that has 0 cases of COVID-19. So that's something that is a really big success that we need to keep working towards in the future. But do know that we're getting input from all sectors of our San Juan County and Silverton community.
Yeah, and just to elaborate that, the chamber is definitely taking a business perspective seat at the table. And we started that weekly conversation last week with business owners. And then we will also create a specific survey to get input for business owners as to what their current needs are and what they're projecting their future needs are going to be. So it seems to be a very well-rounded approach into our reopening plan, which is not only following science and data within our state, but also looking at the economic impacts and how do we come out of this strong and ready to go as soon as we can be open for business. So I would love to ask Mr. Kimmett, the Director of EMS Services, some questions. So Kimmett, what is the importance or non-importance, as the debate goes on, about masks or wearing masks?
Well, it's a great question, Deanne, and there are a lot of conflicting information out there. So I think it's important to understand the pathophysiology of what this virus is and how it kills so many people and so rapidly. And I think that we first have to understand that this is an airborne pathogen. So what does that mean? That means that it's something that floats out there in the air, from coughs, from sneezing. It can live quite a while on just any surface, and you'll see a lot of different reports out there. But the important thing to understand that the only way that this virus is transmitted from person to person is either person to person, directly. I sneeze, you walk into my sneeze field, and you get some of those aerosol droplets in your mouth, nose, or eyes. And really, that's the only place, right, that you can get this and get it in your body. So it's either transmitted from person to person by something like that, hugging, touching, or it's somebody sneezes or coughs and those aerosol droplets land on a surface and somebody touches it and then they touch their face. So we all see, don't touch your face, wash your hands. And that's why it's either going to come in here, or in your eyes. And if you keep that obstructed to the best of your ability, you're going to really minimize the potential for transmitting that. So that's why it's important to keep it out of your, or why we would wear masks, to keep it out of our bodies. But once it gets in our bodies, this is what the ugly part of this virus is it attacks your type 2 pneumocytes in your lungs. Specifically, even more specifically, is your angiotensin converting enzyme. So some people may be on what's called an ACE inhibitor. That's what we're talking about there. Once it gets in there, it's going to kill those cells, and then more and more cells die. That's what creates the infection, the pus, like a pneumonia. And the scary part of this is it can move really, really rapidly. A lot of different X-ray films, CTs that I've seen in just a span of 2 or 3 hours, they go from some basilar lung infiltration of this pus to really their lungs filling up, and then you're on a ventilator, and that's how that works. But the only way that it can be transmitted is by person to person. That's why we hear about the curve, flattening the curve, flattening the transmission of this. And the only way this virus can move is by people moving, people contracting it. And let's not forget that you can have it and not even know it. Some people will never even have those symptoms, but they're carriers. And nobody really fully understands why. So the mask situation is really, really important. I applaud everybody in town that I see wearing masks. I would hope that most people will. That's kind of hard to get used to, but you need to wear it to keep the spread. You could be a carrier and not know it, and be spreading it to other people. The way I like to look at this, if you are wearing a mask, you are showing respect to your family, friends, and neighbors, that you value their life. And if you're not wearing it, it's just either you don't understand what this really is about, but you're really taking a risk to spreading it to your family and friends. And I think as we see these new reopening protocols that are going to come out, we'll see that masks, and you're already seeing it in the East and the West Coast. They're requiring people to wear masks if they're going to be out. And that's going to be our new norm for a while, until we get vaccines and we get treatments that will battle this. So, hopefully that comes sooner rather than later. Any thoughts from you guys on that? Okay.
That seems to be some of the information that I'm receiving sitting on these, statewide calls, is that the more comfortable that we get as a community and society with wearing either a face buff or a mask, that it equals, more mobile freedom. So just, protecting ourselves, protecting our friends and neighbors, as you said, from, spreading this, that seems to be a line of defense.
Right. So I think it's important that again, people are wearing masks like these, that we have these surgical masks, the N95s that we hear a lot about, and you can do a homemade one, just something, wearing a buff like Jim's got. Anything that will help protect you is that's going to diminish you getting that in your mucous membranes, is what's going to protect you. So let's keep doing it. We're doing a great job from what I'm seeing in town. So it's really important. And if it gets in town, which in some ways I think it's a miracle if it doesn't. If it does, it could spread pretty quickly. But because again, this has a 14-day, as best anybody can say, incubation period, that you could have it and not know it, and you're spreading it. And just to talk about some numbers real quick, we talk about one person. I'm here, I have it. I don't know that I have it, but I meet with Deanne, I meet with Jim, just those two people, and they meet up with 2 different people and spread it. What we're seeing in a lot of places is that 20% of the people that have this are going to end up in the hospital. Not all of them on ventilators, but they're going to be really, really sick. And that's all I need to do is I need to hang out with Deanne, hang out with Jim, not follow social distancing or physical distancing. It's probably the better term now. And they're going to infect 2 people. So one of those 5 people are going to go to the hospital. And what would that mean in our town if we had 10 people spread that out? That would be a large portion. If our numbers held like some of these other areas, that 20% of those people are going to end up in the hospital, and a high percentage, another 20% of those people are going to end up on a ventilator. And it's a scary thought that how hard that could hit a small town like ours. So wearing masks is going to be a huge step to keeping that spread from happening, and washing our hands and social distancing.
Well, that lends into my next question for you, Kemet. Can you give us a general update about our EMS department?
Sure. So things are changing rapidly. Gosh, the state, the protocols that have come out, and just, you know, to reassure people. I mean, everybody's seen, you know, we've had the H1N1 virus, you know, so many over the last years and decades. So we're pretty well prepared to begin with in our PPE protocols. So what is changing now for us is our assumption is that every patient we see is a carrier, because they may not know whether they are or not. And it doesn't matter whether it's a motor vehicle accident type call or a heart attack type call. We're going to assume they're a carrier, and we're going to give everybody one of these masks and ask them to put that on, and we'll show them how to put that on appropriately. But it goes back to what I was saying about masks. If they're, you know, if they are carrying and they're transmitting, wearing a mask will minimize their ability to spread it should they cough or sneeze. So so we want to keep that down for our protection. And then you will always see us wearing masks, some type of mask, either that mask or an N95, up to what's called a Scott face mask. It looks very much like what a firefighter wears when they're connected to air in a tank. This is just got cartridges, but it's another level of protection. So so that's what we'll be doing, in addition to wearing gowns and other eye protection, and of course gloves. So we're taking those precautions to protect ourselves. We certainly realize that when it comes to our small town, we are the last line of defense when it comes to medical or trauma. We're doing our best to keep ourselves healthy, to practice social distancing. Even when we have meetings and trainings, it's utilizing social distance protocols. And so to try to keep ourselves safe, you know, God forbid that we get a bunch of our guys sick, and we would have a hard time just filling our shifts. So we're taking steps to be as safe as we can, and but realize that we are frontline, and we're going to be in the middle of it regardless, and we will do our best to protect ourselves and protect our citizens. So, and as far as our safety plan, I think we have an excellent safety plan for our community, and we do have contingency plans should our hospitals become overwhelmed. That's sort of our worst case scenario, is if Mercy all of a sudden is full and all their critical care beds are full, and we have to come up with contingency plans to get anybody from our community into the appropriate facility as quickly as possible to get the treatment that they would require. So all that stuff is in place. You know, we have trigger points that we're looking at to make those decisions on what we'll do. And so far, so good. Again, because of, I think, practicing social distancing and people wearing masks has really helped us. And as long as our hospitals are able to take patients, we're going to be in really good shape here.
Great. Do either one of you gentlemen have any final thoughts before I move on and interview our Public Health Director, Becky Joyce?
Yeah, I'll just close out just saying that the community is doing a just absolutely fantastic job. And we know that there is a lot of hardship with this, but I just want to emphasize the importance of these public health orders and taking this very seriously, and that we are all working together as a community to get through this. And also make sure just to check on your fellow community members. And it's just important to maintain that physical distance, but still make sure that you're checking in with people because we know people have a lot of questions and there is a lot of uncertainty, but we're here to help answer those questions. We may not have the answers, but we'll definitely try to get the answers, but just know that we're working to get through this and just helping everybody through this.
So I'd like to talk about communications. For the most up-to-date information for the state of Colorado, the best website to go to is colorado.gov/CDPHE. For local information, the best website to go to is San Juan County's website, and that is sanjuancolorado.us. You can also sign up for email alerts, and if you email PIO@sanjuancolorado.us, you will be added to that list. That is also a great way to ask any of your questions or get any sort of information clarifications that you need. If you'd like to talk to a live person, there is the visitor center staff that is answering telephone calls daily from 10 a.m. to 3 p.m. And that phone number is 970-387-5654. There are a lot of social media pages that are giving great up-to-date information. Locally, San Juan County Public Health Department and San Juan County's Office of Emergency Management. Two state Facebook pages I suggest you follow is Governor Jared Paulus's page and the Colorado Department of Public Health's page. We also have JIC boards around town. There is one at the post office, on the steps of the county building, town hall's building, and visitor center. These are boards that post up the most pertinent information from press releases to community information. There's not as much real estate on those boards as you receive in an email, but it is a way to get up information immediately to those that are not on the technical side of the world, which is a good, decent chunk of Silverton. So we're trying to hit all aspects of communication. There's also a weekly newspaper in town, the Silverton Standard, and if you're not already subscribed, this is a great time to get a email and or paper subscription. And last but not least, it takes each and every one of us. So to touch base with your friends and neighbors and family members, and just make sure that you share those same points of contact, encourage folks to sign up for the email or call and ask questions. But at times like this, and definitely during the COVID-19 crisis, is when Silvertonians need to take care of each other. Just check in with your friends, your family, and definitely your neighbors, especially if they are vulnerable or elderly neighbors. We already do a good job on that on a good day, but it's definitely time for all of us to start reaching out to each other and creating a network of communication, but most importantly, support. So today we're going to end the video chat with one of Sheriff Bruce Conrad's most frequently asked questions.
Hi guys, Sheriff Conrad, the San Juan County Sheriff's Office. One of the questions we've been getting is what's with the increased officer presence at the edge of town. I'll tell you, there's no gates, there's no closure, there's not a full-time officer scheduled to be down there. However, much of our time spent these days during this corona event is spent on the phone answering questions, returning phone calls, and in Zoom meetings, unfortunately. So I might as well kill two birds with one stone and be in my mobile office of a patrol vehicle on the edge of town, further enforcing our public health orders, which are limiting non-essential travel and non-essential visitors to the community. So that's what we're doing on the edge of town. We appreciate everyone helping out and being cooperative. Have a good day.